Yep. Good morning, everyone. I'm Erin Jones from the U.S. Environmental Protection Agency. I want to welcome those of you here in the room, as well as those of you joining us virtually on Zoom or on the phone. Thanks for taking your time out of your busy lives this morning. We've worked hard to accommodate an in-person and a virtual access to this meeting, and to meet any interpretation needs. So we may encounter some hiccups, as we already have, but we're on our way now. So we do appreciate your patience and understanding with that. For those just joining us virtually, if you're having any trouble, please reach out using the chat feature. That's kind of the tech help access window within the Zoom feature. You can find that chat feature at the bottom of your screen. Again, so I'm Erin Jones. I am an Emerging Contaminants Coordinator in EPA Region 4 in Atlanta, and I'm going to moderate today's meeting. In Region 4, I serve as an Emerging Contaminants Coordinator, which means many of the issues I'm involved with center around newer science and evolving information that the agency has learned could be impacting public health or the environment. Sometimes this science is so new that we don't yet have regulations in place. And in those moments, we're actively engaging with stakeholders, communities, and our co-regulators to move towards more solutions that we can use. This is exactly the space we're in right now. So I'm thankful that all of you are here today so that we can give you background on an important issue facing your community. We can discuss our agency's planned next steps, and most importantly, we can answer your questions. We've gathered here at the historic Monumental Baptist Church, and let me stop right here to thank those of you who might call this church home for allowing us to use this beautiful location to be here with you this morning. This church is near the neighborhoods that are impacted by the air pollution, and we want to acknowledge and further explain the risks that exist in this community. For several reasons that my colleagues will describe today, this is a tough issue to communicate. And I want to acknowledge this may not be an easy conversation that we're going to have. So I want to talk about the flow of this meeting, and you can know what to expect and when to prepare to ask questions at the appropriate time. Today, you'll hear from EPA Region 4 Administrator Daniel Blackman, EPA Region 4 Air and Radiation Division Director Caroline Freeman, EPA's Headquarters Senior Risk Communication Advisor Madeline Beal, and Shelby County Health Department Director Dr. Michelle Taylor. We'll also have a panel of technical experts available for a Q&A session, including our partners at the Agency for Toxic Substances and Disease Registry, or ATSDR, and the Shelby County Health Department. We're going to address questions this morning once our speakers have shared their information with you. So when the time for Q&A comes, we'll first ask for the folks in the room to walk up to the microphone in the center aisle and ask your questions. Then we'll rotate to the folks who have joined us on Zoom, and they would use the Q&A chat to type their questions. So if you're on Zoom and you are in the middle of the presentation, please feel free, go ahead, enter that question into the Q&A chat and submit it as you think of them. Then for the third rotation, we'll remind anyone who's on the phone to unmute themselves and raise any questions. We'll continue to cycle from those here in the room, online in Zoom, or on the phone every 5 minutes or so. And as the moderator, I'll do my best to keep us on target and to make sure that your questions are answered and that we communicate clearly about what we know and how we're working to address it. This might mean asking you to clarify your questions or asking our speakers to readdress something that I feel is unclear. I also want to acknowledge you may have other concerns this morning that aren't just from the risk from this one chemical or one facility. And while it's always important for us here at EPA to hear all your concerns, our team that's here today is prepared to update you on the specific source of pollution in your community. However, if we don't know the answer to a question or questions, we will do our very best to follow up as soon as possible afterwards. It's very important to us. Next slide. If we don't get to your question, please know you can always EPA the Region 4 folks at Region 4 ETO at epa.gov or call 800-241-1754. Also, we're recording this session and we'll make these slides available as well, so that those of you who couldn't join us today can access the content, or those who are here can go back and refer to it at your convenience. The website link shown on this slide will eventually host this meeting's recorded content and slides. With that, I would now like to introduce our Region 4 Administrator, Daniel Blackman. In his role, he oversees our agency's goals of protecting human health and the environment here in the Southeast region. For those of you that don't know, EPA Region 4 represents 8 states, including Tennessee, and 6 federally recognized tribes. Regional Administrator Blackman is a passionate leader who has dedicated his career to creating economic opportunities for marginalized communities throughout the South and working to ensure a healthy environment for all, not just a select few. R.A. Blackman, the floor is yours.
Good morning. You guys can do better than that. We came all the way to Memphis in this beautiful space to coordinate with you all and to speak to you. So on behalf of Region 4, we are truly appreciative of your time. We thank the panelists. I want to thank my region and those who not only came, but it's very important for us to be here. Actually being in the house of the Lord, we are all reminded of the importance of us being here and being present in this space. There's a scripture that says, wisdom is the principal thing, therefore get wisdom, and in all thy getting, get understanding. So our focus today is to not only listen and to learn and to communicate, but to really show you all that being in this community is an absolutely critical part of our service to each of you. On behalf of Administrator Michael Regan and the administration, the Biden-Harris administration, I want to start off by saying our journey to justice started in Region 4. It started in Jackson, Mississippi. And so knowing that we are truly, truly committed to community engagement, to working and to listening, and our posture to be to make sure that we are more of in alignment with how we can work with, support, and lead in the community is contingent on how well we not only show up, but communicate with each of you in this space, not only today and this morning, but going forward. So this is not the last time you'll see us. We'll continue to communicate and be in as much correspondence with you all as possible. Aaron, thank you so much for the introduction and for the information that was shared. And to those of you online, we hope that you can hear us well. And if you can, we hope that this message is conveyed to you as well as it is to all those who are here with us today. It's extremely important for us to convene this meeting with the residents and other impacted communities and groups near the Sterilization Services of Tennessee facility. I think it's important not only for you all to know that, but before my comments, prior to being appointed by President Biden, I served with the King Center as a national policy advisor and come from a space working with the civil rights community, and very, very, very proud to announce today that on September 24th, Administrator Michael Regan in Warren County, North Carolina, the birthplace of the civil rights movement, the environmental justice movement, we announced the new opening of our Office of Environmental Justice. So I want you all to know that this being here today is not to check a box. It is to literally put our policies, works, and desire to be a better and more supportive agency, both publicly and with our state partners. It's very important for you to know that not only our backgrounds and our commitments and what we are aiming to do is not only focus on areas like Memphis, but this region is heavy on environmental justice issues. And our success is measured based upon how many underserved communities and individuals we're able to not only be in front of, but to support and to serve. My comments will be brief, but this conversation will be extended. And we hope to make sure that when we leave here today, we have a better understanding and footing on this issue as a whole. Knowing this, we're in an unprecedented time of access. I think it's important for us to remember that equity and leadership, as I mentioned earlier, it's not just about checking a box. I think the conversations you will hear today will remind us that we're not here to do business as usual. One thing we learned from the pandemic was the fundamental importance of being in the community. A pandemic for so long kept us isolated, but it also reminded us of the tremendous responsibility of being able to convene and be in person and not just do things virtually. I think it's much more important for those of us in Region 4 and those who share this podium and the dais and stage with me. It's important for us to be in front of you. It's important for us to listen and to hear from you directly. Biden-Harris administration has taken on a whole of government approach, aggressively implementing programs and initiatives to embed not only environmental justice, but as I mentioned, external civil rights. These are areas that we don't see being done in silos. We think that civil rights and environmental justice and every other policy as it relates to social impact in communities, just like this area right here in Memphis, we believe that we can do multiple things and not just limit a community to one space. But we also recognize and acknowledge the severe responsibility we have in not only pursuing your trust, but maintaining that trust and communicating and following up in a way that will allow us to be able to restore the faith in the way in which we operate as a federal agency and communicate with you overall. And today's conversation will give more of an example of the efforts that we are making, and we're stepping outside of our traditional role and proposing rule and giving the community a certain amount of time to learn about the rule and provide feedback, all during the rulemaking process. And what that means is we don't want to have a separate meeting that we do not allow you all to be a part of. I think it's important for you to recognize the importance of people like myself and Caroline, Freeman, Aaron, so many of us that are here. It is very easy for us to convene a meeting from Atlanta or from Washington and to let you all know what we've decided. And I think that that is not the way you build community trust. We build community trust from the inception of a conversation that will allow us to be able to be as transparent and forthright as possible so that we can communicate in a way that the problem that we are hoping to solve can be resolved with your support, with your input, and with a long-standing commitment, knowing that the presented challenges to us are that you know of now is something that is very, very contingent on the input that you all give. And the one thing that I'll say before I continue in my comments is I need you all, to the extent that you can, to take advantage of this space. I can't articulate enough the importance of having us in this room. I don't say this arrogantly, but we came a long way, and we're not going to solve everything in this meeting alone. Take advantage of the individuals that are here. There's so many opportunities through this administration and the president's commitment to infrastructure and to environmental justice in multiple areas. And we're here because we understand that there's so much more work to do. I want to thank the staff again at the agency, at EPA, but also at the Agency for Toxic Substances and Disease Registry, the Shelby County Health Department, and Tennessee Department of Environment and Conservation. Again, this is a new approach for EPA, and we're grateful to those that we work closely with to ensure the fair implementation of environmental laws and the protection of public health and environment. And we're working really hard to coordinate that. I mentioned earlier about a journey to justice that we started off in Jackson, Mississippi. We got a lot of pushback from that. And we got pushback because, as you know, whether it's in Georgia, Florida, Alabama, Tennessee, Mississippi, North Carolina, South Carolina, Florida, or any of our 6 federally recognized tribes, the relationships between state agencies and grassroots organizations, faith-based organizations, community organizations is not always the greatest relationship. Our job is not to point fingers, it's to help and join and strengthen our relationship with state partners. And we got a lot of pushback initially with our journey to justice because a lot of folks felt that we should have convened everyone at one time. We don't have a one-size-fits-all approach. Our approach is to make sure the community knows where we stand and how we want to communicate for days, weeks, months, and years to come. We're here today to talk about air pollution from chemicals, from a chemical called ethylene oxide. And many of you all may or may not be familiar with it in that term, but we all know environmental justice is so much more than just water and land, but in the air we breathe and the chemicals that we encounter every day. And as my colleagues will discuss more in detail, ethylene oxide can cause health risks, and it's also an important chemical to ensure safety of a wide variety of medical devices that are used by doctors, hospitals, and dentists. So there's a challenge in understanding the health and the wellness of our communities and working with specific spaces, that are responsible for how they manage these practices. This chemical is used in a type of facility known as a commercial sterilizer. There are about 100 commercial sterilizers around the United States, not just in Region 4, and some of them are emitting ethylene oxide into the outdoor air at levels that are very, very concerning to our agency. And again, transparency is of the utmost importance to making sure that you all are aware where we stand and what our concerns are. This includes the sterilization services to Tennessee facility right here in Memphis. And again, this is not a conversation that we're limited to one location, one city, or one facility, but an ongoing conversation on addressing this issue. As we stated earlier, this is only the beginning of a conversation. EPA shares this information now so that you have access to the same information that we have at EPA, and you can make informed decisions about the risks and your health. And EPA is committed to keeping you informed throughout the process. And on a lighter note, I don't mean this in a disingenuous way, but there's a quote that I always use that says, if you're not at the table, you're on the menu, right? And I think it's important for us to realize that allowing you to be in the room while we're thinking about a process is very critical to us being here. And we want to very much thank you for your presence here online, but also in person. First, and just to make sure you know about the process, first, risk in Memphis is high. We want to start off by saying that, and EPA is concerned about this risk. Second, we are committed to protecting health and communities facing risk from ethylene oxide, and we're taking this issue very, very seriously, and it will be noted duly by those who will present today, and specifically from my team here on the ground from Region 4. I commit to you individually as a regional administrator today that we will continue to work on this issue until the risk levels are reduced. This includes using the tools we have available to us and the totality of the agency, and as well as President Biden's whole of government approach that we've committed to. This includes regulations and on-the-ground partnerships with states, communities, facilities, and anyone who can work with us to help reduce these risks. These partnerships have already reduced risk in a number of communities, but we need to do more, and we will, and that's why we're here today. Third, each and every one of you here deserve to be a part of this process, to have your voices heard, your concerns shared, and your needs met. That is what a democracy is about, and it's what we are committed to in our overall mission as an agency. You can also find more details about everything that we will talk about here today, including how to make your voice heard, on EPA's website, which was shared by Aaron earlier. And again, Aaron, thank you for helping us logistically and to present the information. It will be up later, and we will be around after this conversation. But you can directly reach out to us. You can coordinate and communicate with us, and I'm sure you will share your statements and your comments. And on behalf of Region 4 Administrator Michael Regan and the President, we want to thank you for this opportunity. We want to thank you for your presence, and we very much look forward to your conversation, your comments, and engaging you throughout this process. I'll turn it back over to Aaron.
Thank you, Regional Administrator Blackman. I just want to remind this top here really quick to allow the folks that have just joined us online in the interim that we're recording this session. Just a reminder to post, we'll post the Memphis on the Memphis ETO page, and we'll also have Q&A after to allow presenters to type their questions online. If you're online, please go ahead and use that Q&A panel. At this point, I would like to introduce Madeline Beal, who works at EPA headquarters and assists us with risk communication issues. So Madeline is going to walk us through quite a bit of the risk part of the content. Thank you, Madeline.
Thank you, Erin, and thank you, Ari Blackman, for getting us started. So I am going to share some information, get into more details about ethylene oxide, and talk about...
Just real quick, if it's okay, I think our ASL interpreters might be switching. I want to give a chance for that, if it's okay.
Okay, I can take a moment.
Yeah, just 1 second. Anna, are you rotating off? Perfect. So Kyle, if you can turn that one and switch the other. We have 2, so they can switch off and take a little bit of a break.
It's a lot of work, they need a break.
Yeah, just give us just a second.
Especially when we talk fast.
This is a nice reminder for the folks that are online. If you have any questions as Madeline's presenting, use that Q&A feature that's on there to type in any questions that you might have. And I see we've got Miriam up here and Kyle. You can just get her pen for any folks in the room that might need this service. It's up just a little, there you go. Perfect, all right, thanks Madeline.
Great, so thank you. So I am going to give some of those details about ethylene oxide and the risks that we believe there to be here in Memphis. And we also want to make sure there's going to be a lot of technical information in this meeting. If you guys have questions, we need that to drive some of the conversation, because sometimes I'm guilty of it myself, that sometimes at EPA we get a little too into the technical jargon, and sometimes we need to take a step back and make sure that we're meeting you where you all are and what you need. So please tell us if we're not doing that. It's important to us. So before I get into those details though, I also want to share something personal about me, which is that I'm a mom of 4 young children, and I approach my work life, I approach all of my life as a mother first. And as I have gone through this work and worked on ethylene oxide as an issue, it's very concerning to me what it might feel to be out there where you all are, learning that there might be a risk to your family. And I just want to acknowledge that it's totally reasonable if you're angry or upset or mad. Even if you're mad at me personally, that's totally reasonable. And we want to get to a better place where we can make sure that you feel like you have what you need to make some of the decisions that you're going to make for your family, but also, as Daniel said, for you to help us as an agency get the results you need to make sure that your community is safer. A big part of my job is to try to explain risk to impacted community members. I think it's really critical for us as an agency to do this work. We can't do our job as an agency to protect human health without doing this work. But we really do need you to help us do it better. So if you have those questions, please ask them. So I think it's the next slide, but I think Daniel actually covered my first slide, so I think we can skip that one, which is great. So I think Daniel covered those points, so we can go right into the meat of what ETO is. So you've already heard that we're talking about air pollution from a specific chemical that's called ethylene oxide. Some of you may already know a lot about this, so for those of you who already know a lot of the background, please bear with us. I want to make sure we're all starting from the same basic points. So ethylene oxide, we often call it ETO. You will hear us say ETO a lot today. It's the same chemical. Sometimes people call it EO too. We don't typically call it EO at EPA, but some people call it that as well. It's all the same chemical. It's all talking about the same issue when you're talking about those three things.
Madeline, can you slow down just a hair and maybe talk a little bit closer to that microphone for our online folks?
I will do my best.
Thank you so much, Madeline.
I tend to wander when I talk. Taylor's trying to keep me in line here, but it's good. So ethylene oxide is a gas. You usually can't smell or see ethylene oxide in the concentrations, in the amounts that we think it's coming out of this facility in the community. It is used to kill bacteria and other germs. It is used as a sterilizer specifically for medical equipment, and that is what Sterilization Services of Tennessee uses it for. They use this chemical to sterilize medical and dental equipment for use so that when you go to the doctor or you go to the dentist, you can be confident that that's a safe piece of equipment that they're using and you're not going to get an infection from that equipment. ETO that's what it's used for. We're going to talk about what we are worried about, but it can be helpful just to know a little bit about what we're not worried about, because there is a little bit of good news in that. There are some things that we're not worried about from this chemical. So one is that this is an air pollution issue only. This is not an issue where we're worried about the ETO coming out into the water or onto the ground in any way that is causing risk. We have not seen any evidence of that. When it comes to short-term health benchmarks, we have not seen any evidence that ETO near this facility is causing urgent or acute health issues, things like nausea or dizziness or making your eyes water. Those sorts of like immediate short-term benchmark risks we have not seen. The science that we've done only shows risk from a long-term exposure to this chemical. And then the final point on this slide is that generally as a consumer, so if you're someone who uses medical equipment, if you're getting an IV at a hospital, you typically don't have to be worried about ETO that's left over on that product. So the risk that we are worried about, though, is to people who live near these facilities or who work at or perhaps go to school near them. And so that's what we're going to talk about next. So these things are on the slide are for the most part what we're not worried about, but what we are worried about is that ETO can cause cancer when you breathe it over many years. At EPA, we have a specific definition for what it means to be long-term exposed. So we say from birth until age 70, if you breathe this chemical every day, 24 hours a day, that's how we calculate long-term risk. And what we see is when people have long-term exposures to ETO, it can cause certain types of cancers, including breast cancer in women and lymph and or blood cancers. If you've heard of those types of, sometimes people call them one thing or the other, but it's a class of cancer called white blood cell cancer.
Madeline, can you slow down again? I'm sorry,
Sure.
Our folks online, our ASL interpreters, want to catch up with you as well as our services that are doing captioning. So just
I apologize.
little slower.
I will do my best.
Thanks.
I will do my best. Okay, so some people are more at risk from ETO exposures than others, and this is important as we think about how to control risk, but it also might be important to you as you think about your personal risk. So people can either be more at risk because they're exposed to more ETO, and this happens, hypothetically, might happen to someone who works at one of these facilities, right? Because they're around a higher amount of ETO for a good part of their day. It can also happen if for some reason your body is more susceptible to ETO, and children and babies are more susceptible for this reason. They're more vulnerable to ETO exposure because their bodies are more susceptible to the chemical. Caroline is going to talk a little more about this in a minute, but because we know that children and babies are more vulnerable, we take that into account in the way we do our science. So we start our analysis at birth because we want to make sure that we are being protective of children when we set the rules that are going to govern this issue. So I'm going to get a little more context on the national issue here. So Daniel talked about this just a little bit, and it's a little hard to see the blue versus the white on this, but we do have this map online as well, so you can see it there. But I just want to show you where they are. I know you guys are going to be mostly concerned about what's happening in Memphis, but I just wanted to let you have the national level context on where you guys fit in the whole country. And so there are about 100 of these sterilizers in the country. When we have done this analysis, there are 23 that are in that highest risk category that we are most concerned about. The one here in Memphis is one of those 23. Those blue ones are the ones that, if you can see the colors, the blue ones are the ones that are higher risk. I want to note too, though, that we're not just worried about the 23, and we're not just worried about people that live near these facilities. Most of this meeting today, we're going to be talking about work that we're doing, and Caroline's going to talk a little bit more detail about that in a minute too. Work we're doing to support a rule under the Clean Air Act, which is all about people that live near these facilities. A whole other part of the agency, though, is working on some regulations that will help for people who work at or go to school near these facilities as well. And so when we think about reducing risk, we're interested in reducing risk at all 100 of these, but we really are focused on those 23 where it's highest because we think you guys have the most need. So next. So this is sort of my final set of thoughts on this before I hand over to Caroline to get into some more of the details on what we're doing next. One of the challenges is, in terms of thinking about what this risk might mean for you, is that EPA, when we do our risk analysis, we're thinking at a population level. So we're thinking, if 1 million people exposed, how many of them might get cancer from that exposure? And that's kind of a hard thing to turn into what that means for me personally, what that means for my family. And we make some assumptions in that maybe aren't super true to life, because we have to do that in order to understand the big picture perspective. But if you're sitting in the room tonight, you probably want to know, what does it mean for me and my kid, right? Or me and my family. And so for that, I would encourage you to think about these 3 points, right? So the first thing you need to know if you want to know what your personal risk might be is how close are you to the facility? And the further away you are from the facility, the lower the risk. And we do have a map that points to some of this, but it's not an absolute, right? Like the further away you are, generally the lower the risk. The other piece is how much ETO is coming out of that facility. And then the third piece is how long you're exposed, both in terms of how long you've lived here near the facility, but also how many hours a day you spend in that area that's close to the facility. At EPA, we're very much working on that bullet number 2, how much ETO is coming out of that facility, because that's the best way to reduce risk across the board. It's the best way for us to get to a place where your community is safer, and ultimately that's what we want to achieve. But all 3 of these are important if you're wanting to know what this risk might mean for you. And we want to acknowledge that this facility has been there for a long time. And so we know that this risk has been ongoing for a while. So if you want to think about sort of how this puts, as Caroline talks through some of the numbers, how it might apply to you, those 3 points are the main thing. So I'm going to turn it back to Erin.
Thank you, Madeline. I would now like to introduce Caroline Freeman. She oversees a team of technical experts working on air issues at EPA Region 4 in Atlanta. Caroline works closely with state, tribal, and local governments, just like Shelby County Health Department, industry, and others to achieve and maintain clean outdoor air, including a reduction of exposures and risks associated with criteria and hazardous air pollutants, like the ethylene oxide risk coming from the commercial sterilizer in your community. Caroline, I'll turn it to you.
Thank you, Erin, and good morning, everyone. Today I will be sharing information with you about risk posed by ethylene oxide from Sterilization Services of Tennessee. This risk is in your community, and I also want to talk to you about the actions that we are taking at EPA to address this risk, in addition to the work that is currently going on in preparation for the rollout of this rule, so that you will have the same information that we have, and also to ensure that you have an opportunity to comment on this rule. Now I'm going to share a little more with you about the analysis that we have completed and what it tells us about this community. Between 2021 and 2022, EPA scientists collected analysis that best informs the work that we're doing right now. And that information that we collected and was able to build that analysis on is specific to the Sterilization Services of Tennessee facility. The EPA then combined that data with other local information such as weather-related patterns, and also where the locations of the homes are that are near this facility. Using those factors, the EPA was able to model the risk from ethylene oxide. I want to note that the EPA analysis only reflects your potential exposure risk to ethylene oxide from Sterilization Services of Tennessee. Therefore, the risk that I am sharing information about today is an additional or incremental long-term risk for getting certain cancers from ethylene oxide that we have modeled. I want to remind you about what Madeline said earlier, that to estimate risk for any given chemical, we need to know three things at EPA: how toxic that chemical is, how much of it is in the air, and how long throughout a person's life someone might be exposed to that chemical. Because EPA's analysis, must be protective of human health and the environment, these estimates are very, very conservative and are on the high end. What does that mean? That means that we assume that people spend all of their time in the area where the risk exists. Specifically, we assume that an individual spends 24 hours a day, 7 days a week, from the age of birth until age 70, where that individual is breathing in ethylene oxide at that concentrated level. These might not, be realistic assumptions, because almost everyone at some point in time leave their home. But these assumptions help us to ensure that going forward, we protect the most vulnerable, even in the most extreme situation.
We're gonna go ahead and switch off our ASL interpreters real quick, Caroline. And also, if you can move that mic just a little closer to you for our online folks.
Do that whole
Thanks,
thing.
everyone.
Right, huh? Should have done it for me.
Is that better, Taylor? Okay. Okay. All right? Okay. Now I'm going to share with you a Google map of the street area in this community. I actually drove out on yesterday just to see if I can identify some landmarks to better paint this picture for you, to show you the boundaries of where the area of concerns are that we have modeled. And so I'm going to just use the street names as my boundary points to actually walk you through to give you a picture of where this modeled risk is that we have modeled at EPA. And so from where the facility is located on Florida Street, the impact extends to the east of Peoples Road. And I heard on the radio when I was driving, an announcer said Pebbles Road. And it was kind of interesting because I'm like, okay, I'm not sure if it's Peoples or Pebbles, but it's spelled Peebles, okay? It also extends from the facility north to South Parkway East, and approximately 250 feet west of the intersection of Interstate 55 and Riverport Road, and east to South Lauderdale Street. Now I'm going to transition to the gradient map that several of you have already seen earlier this morning, which is positioned to my right and also behind me on the screen. The gradient map that is displayed on this slide is used to show the ethylene oxide risk from Sterilization Services of Tennessee. I would also preference that we believe that there is elevated risk to people who live closest to Sterilization Services of Tennessee. But I want to be clear that there is also potential risk to people who work at this facility or people who work near this facility, as well as individuals who go to school near this facility. Now I want to point out a few features on these maps. The dark orange box, that's the facility itself. The lighter orange box is non-residential areas near the facility where risks are high. And when I say non-residential, other businesses or industrial facilities that are located in that area. Now, the blue area is the area that includes residential structures, okay? And so in the blue area, where you see the darker blue shading, that reflects where the higher risks are from this facility, and the lighter shading actually demonstrates where the lower risk is, albeit still at or above 100 in a million. Note that as you move away from this facility, the blue shading, gets lighter. And so as we get to the end of that gradient area, that's where the risk falls off. There are some uncertainties, I must say, with these estimates, as both operations at the facility and weather, as you know, can change. Okay, when you look at the weather from last week to what we're experiencing right now, all of those things must be taken into consideration when you're modeling risk. But these are the best health protectiveness estimates that we have available to us today. At the EPA, we are concerned about all risk, but we use 100 in a million as our benchmark for identifying where risk levels are considered high. When we say 100 in a million, we're saying that we estimate ethylene oxide exposure could contribute to an increase of 100 cancer cases if 1 million people were exposed at that concentration 24 hours a day, 7 days a week, from birth to age 70. We start our calculations at birth because we want to make sure that we are protective of children. Under the Clean Air Act, we focus on risk where people live. We are also concerned about risk to workers and others who may spend time in that area because of work, or others who may go to school. And so, for the most part, that's what's covered under the orange area on this slide. The information that we're sharing today have been posted on the web. It is also based on information that EPA has collected specifically from Sterilization Services of Tennessee about their usage of ethylene oxide. As we at EPA receive new data, it is our goal to provide updates to our EPA website about this facility. And also, it is our goal to continue to collect information and verify information about this facility as we learn more and are able to verify that information. We will make that information available on our website as well. Okay, at EPA, like I said, we don't take this lightly. You've heard it from my regional administrator, you heard it from Madeline, and you're hearing it now from me as the air director. We take this risk very, very seriously. Now I want to talk to you about some steps that we have taken at the EPA to reduce this risk. You know, while we fully understand, you know, the risk here in Memphis, most recently this past July, when we received the latest round of information from Sterilization Services of Tennessee, we have been working on this issue for some time. The EPA has had regulations in place to address ethylene oxide emissions now for 30 years. And those regulations stem back to 1996, and that's the National Emission Standards for Hazardous Air Pollutants as it relates to commercial sterilizers. In 2016, because of updated science, we learned that ethylene oxide was more dangerous when we breathe it in. In 2018, a national level analysis provided an initial indication of which areas might have higher risk, but it wasn't detailed enough either to inform our regulation or really to help communities. So we needed to collect additional data on this pollutant to learn more about exactly where these risks are located and what solutions, you know, are available to prevent these risks. That work took about 2 years, and it brings us to where we are today. I also want to note that while the EPA very recently came to know the exact details of potential risk here in Memphis, EPA understands now that the risk has potentially been occurring in your community, probably as long as this facility has been using ethylene oxide to sterilize medical supplies, which stems back to like 1973. To be clear, our risk estimate present current, not historical conditions, because that is the best and in some cases the only information that we have. It is also the information that we need in order to set more stringent regulations in place to move forward. I want to take a step back just for a minute to explain to you exactly, you know, where this pollution is coming from in the facility, okay? Because I think this information is important to understand how solutions can be put in place to reduce the risk. There are two ways that ethylene oxide can, in fact, leave a facility, and I know you see two pictures on this slide behind me. The first is that after ethylene oxide is used to sterilize things, it is sucked into a control system. These systems actually clean out the ethylene oxide from the air and capture it or break it down before releasing as much air into the environment, which means very, very small amounts, if any, would be released. This type of ethylene oxide coming out of the facility is called controlled emissions. Okay? Sterilization Services of Tennessee has controls on several processes at their facilities. Their sterilization chamber and primary aeration room, which is the area where the medical supplies are placed to actually continue releasing residual ethylene oxide. And for the most part, those emissions of ethylene oxide are passed through control devices that are required by the state and federal permits and the standards that are in those permits and regulations. The second type of ethylene oxide that we are concerned about and that we're talking about today does not get sucked into the control system. It is ethylene oxide that escapes through other places such as leaks, could even escape through the ventilation systems, gaps in windows, open doors. That's the ethylene oxide that we're talking about. This escaping ethylene oxide is sometimes called fugitive emissions. And I want to be clear here. Fugitive emissions, unfortunately, was not covered under the current regulations because when that regulation was written, we did not realize their importance. At Sterilization Services of Tennessee, the majority of risk is coming from these escaping emissions or fugitive emissions. And as a matter of fact, about 86% of those emissions are fugitives. And we were able to model those emissions based on the information that we have about this facility. The best solution to reducing this risk is to reduce the amount of currently not regulated ethylene oxide fugitive emissions that is coming out of this facility. Unfortunately, there are not many actions that you personally can take to reduce risk, because this isn't chemical that you can easily remove with a home filter, and I'm talking about the air filters, or completely reduce your risk by just staying inside of your home. However, spending less time near this facility would actually reduce your risk. But again, the best solution is to reduce the amount of ethylene oxide that are coming out of this facility as fugitive emissions. We have also learned that ethylene oxide is not a chemical that lasts for a long time in the environment. This means that by reducing the amount of ethylene oxide coming out of this facility, we will also reduce risk to the neighboring community right away. What to expect next? Well, the EPA is in fact taking action to reduce the amount of ethylene oxide coming out of this facility and others like it. At the EPA, we are updating the air pollution regulation that limits how much of this commercial sterilizers, such as Sterilization Services of Tennessee, can put into the air. Secondly, the EPA expects to propose the updated air regulations in the upcoming month. At that time, there will be a public comment period and at least one virtual public hearing will be scheduled. The public comment period for major air pollution regulations such as this one is typically about 60 to 90 days. Regulations often take about a year to become final, after that public comment period closes. Once a regulation is final under the Clean Air Act, new facilities, meaning any facilities that's getting ready to start up as a commercial sterilizer, must comply with those more stringent regulations immediately. The challenge is, this is not a new facility. This is an existing facility. And so for existing facilities, the EPA does provide up to 3 years for these facilities to comply with the more stringent regulations once that rule is final. However, I need you to hear me on this. EPA do plan to solicit comments from the public on a shorter compliance period. So that is why it's critical that you are aware that these rules are coming forward, as well as, be prepared to comment on them when they are released. During the public comment period, like I said, you will be provided with an opportunity to comment on the proposed regulations. One of the things that I will be working on with my staff back in Atlanta, as well as my partner with Shelby County Health Department, is a more streamlined summary of the regulations to share with you so that it'll be an easier, digestible reading document for you. Not only that, but in the interim, I just want you to know that we are working with our federal partners, our state and local government partners, such as Shelby County Health Department, and the facility, not just this one, but nationally with these high-risk facilities, to try to get some early reduction before the rule is finalized. As I mentioned before, we are concerned about the risk to workers in this facility and to people who work nearby and go to school near this facility. That is why EPA is also working on a worker exposure rule under another federal law, and intend to take action on that rule along with the commercial sterilizer rule very soon. The Tennessee Occupational Safety and Health Administration is also available to respond to occupational exposure risk for ethylene oxide as well. OSHA is also the responsible agency for addressing worker exposure and protection type issues. So please, feel free to reach out to, I said OSHA, I should have said Tennessee OSHA. At EPA, we are big on acronyms, and I have to catch myself sometimes, so please forgive me. Right, next slide.
We're gonna have a real quick switch here for our ASL interpreters. Kyle, if you could pin Miriam up and let Anna take a quick break. Great, thanks, Karen.
All right, so as I, come to the end of the information that I have prepared to share with you today, I want to leave some points with you. And you've heard some of these same points previously from Madeline when she was up here at the podium, but I need you to know that EPA has learned that ethylene oxide is causing health risk in your community. Okay, we were more certain about what that risk looked like as of July of this year, because I wanted to make sure before we hit the ground and come to this community that we had the latest available information. And we worked hand in hand, with our partners at Shelby County Health Department to ensure that we QA/QC that data so that we can model it to ensure that we have the latest information and the best information. Not only that, we are working every day to reduce this risk. And we're working across government, not just in a silo or in a vacuum by ourselves. We're working with our co-regulators at Shelby County Health Department to reduce the risk of ethylene oxide coming from Sterilization Services of Tennessee. We are also strengthening 2 sets of regulations. Listen to me carefully. At the EPA, it is our mission to protect human health and the environment. And so we are doing everything that we can to move these regulations as quickly as we can so that we can put these more stringent regulations in place so that the facilities can put the additional control technologies in place to reduce the ethylene oxide emissions that's escaping when those big garage doors are rolled up for these shipping trucks to be loaded to transport this material to other locations. Also, we're sharing this risk information with you that we have become aware of now so that you will have the same information that we have. As I prepare to close, I must speak on accountability. As several of us have mentioned at the onset, we have a responsibility, and I take my responsibility very seriously. And so does the other members of the EPA, the Agency for Toxic Registry and Disease Control, as well as Shelby County Department of Health. We take our responsibility very seriously. And at EPA, we're doing this, I must say, by relying on the most current scientific information that's available to us. Not only that, we believe in holding these facilities accountable. That's why we've been coordinating with the Shelby County Health Department on a regular basis to ensure that we are aware of the latest compliance status of this facility. The facility is in compliance with the current regulations. And Dr. Taylor will talk more specifics about the facility as she comes behind me. As my regional administrator said earlier, I can't steer away from this. We are committed to continuing to work on this issue until the levels are reduced. That's the one thing we can assure you. As the EPA Air Director for this Southeast region, I too take this risk seriously. And I am committed, and I am committing to you this morning that I'm going to do my part to ensure that we keep our website updated with the latest information so that you will know where things are with reducing the risk at this facility. Keep in mind, as I said, this is a long-term risk that we have modeled. It's a conservative one, but we looked at from birth to the age 70, someone breathing in ethylene oxide at those concentrations, 24 hours a day, 7 days a week. Okay? I don't take it lightly that some individuals are, more sensitive than others. And so, whereas we modeled a 70-year risk, that doesn't mean that applies to everybody. But that's the risk that we have modeled to inform our regulatory efforts so that we will know what kind of pollution control technology needs to be put in place to ensure that we reduce the risk coming from facilities such as Sterilization Services of Tennessee. So now, as I turn the meeting back over to Erin, I want to thank each one of you for your time and attention this morning.
Thank you, Caroline. I just want to reiterate again, as she said, this is a long-term process we're starting on. So this is not our last time meeting with you even today, but ongoing, we will have opportunities for you to get updates on our next steps on our webpage. You can always reach out to the region with our email or a phone line that we have on the slides. We just want to make sure we maintain those lines of communication as we move forward. Caroline did mention also QA/QC data, so we wanted to spell that acronym out, and I use acronyms all the time too, so y'all feel free to catch me. But QA/QC, the data that we got from the facility just simply means quality assurance, quality control. So we were double checking, making sure we went back and forth with the facility if we needed to understand that data and where it came from and what it meant. So that's what QA/QC meant there. But again, thank you, Caroline. I would now like to turn it over to Dr. Michelle Taylor. She is the director of the Shelby County Health Department, and the Shelby County Health Department is the permitting authority for the Sterilization Services of Tennessee facility. And Dr. Taylor is going to be sharing some additional information with us at this time on the facility. Thank you, Dr. Taylor.
Thank you. Good afternoon, everyone. Thank you for your continued attention. I will not be before you long, but we wanted to make sure that you had the local perspective from the Shelby County Health Department. Sterilization Services of Tennessee began operations in Memphis in 1976. Ethylene oxide has been in use at that facility since at least 1979. I know Caroline Freeman said at least 1973. But the important thing to know is that it has been permitted within standards since 1985, and it continues to be in compliance with EPA's current rules and regulations regarding ethylene oxide. And I think that's an important point to make here, mainly because the reason why our partners at EPA here are here today is to make sure that all of your questions are answered about not only what they're modeling, not only the risk, but also to get your voices heard about ethylene oxide in your community, and to make sure that you are intimately involved in the regulation changes. So it's great to see so many of you here and engaged. Sterilization Services of Tennessee has 8 employees. They operate 24 hours per day, 7 days per week. And they provide sterilization of medical instruments for hospitals, clinics, surgical centers, dentist offices, and the like. And I know you've heard this ad nauseum. One of the things that Shelby County Health Department is doing is collaborating with the Tennessee Department of Health and the Tennessee Cancer Registry for a cancer incidence study, also known as a cancer cluster study. And I know a lot of the folks in the audience have heard those terms before. Mainly what it is a formal study of the neighborhoods surrounding the facility to see if there is a greater than expected number of cancer cases in the area around the facility compared to other regions in Shelby County. This is really important. And I understand this because, like my colleagues have shared earlier, you want to know what the risk is to yourself, to your family, to your neighbors. And this study is going to get us closer to having some of those answers. And I will tell you that the Shelby County Health Department, along with our partners at the EPA, are committed to coming back to you once this study is completed to let you know what the findings are and to discuss next steps. And so normally a study of this size and scope takes about 2 to 3 months. So expect to be hearing from me and my team within 2 to 3 months with those results. And the study will look at all kinds of cancers, but specifically the ones that folks are at higher risk of having due to ETO. So those are blood cancers like leukemia and lymphoma, as well as stomach and breast cancer. Finally, we wanted to share some community resources that are existing right now in the community if you are concerned that you need to be screened, or you just want to be screened because you think that's the right thing to do, particularly with the identification of this potential increased risk. So the Shelby County Health Department has the Tennessee Breast and Cervical Screening Program. Phone number is on the screen, and you can call and see if you are eligible for that program to get screened. Christ Community Health Services also does all kinds of primary care, and they are a good resource to be screened. Baptist Women's Health Center has a mobile mammography unit, and the phone number is on the screen to call them and set up for them to come out to possibly your community center or a church. And then Methodist Levanter Healthcare also has mobile mammography. Now, this is not an exhaustive list, but one of the things I can commit to you on behalf of the Shelby County Health Department is that we will continue to reach out to our provider partners, our hospital partners, to bring these types of resources to the community that is affected, to make sure that we continue to promote and protect the health of all in Shelby County. So I appreciate your attention, and I'm going to turn it back over to Erin.
Thank you, Dr. Taylor. So we know that was a lot of information, and we would now like to take any questions that you may have. I have here with me, thankfully, Taylor Gillespie, who's going to be assisting with the online portions of our engagement today. So thank you, Taylor, on your big help. So she's letting me know that we already have a couple questions coming in through the chat that we can start with. But also for those of you here in the room who may have questions, again, we're going to need you to go to that mic in the center aisle so that you can be heard by everyone in the room and all our online participants. So go ahead and make your way there, but we will start with a few online questions first.
Great. And Laura, if you can make sure that mic is turned on, just so when we get to that section, great. And then if you don't want to come to that mic, or maybe you have some mobility issues, just raise your hand. And my colleague, Brandy, will bring a comment card and a pen to you. So if you want to raise your hand, you can get one of those and you can write down any questions that you have. But while we just take a quick question from online, Caroline, we got one question asking, is ETO flammable? Is it a flammable substance? Microphone, Madeline, if you could bring that one a little bit closer.
Yes, ethylene oxide is a colorless, odorless, flammable gas.
Perfect, and then we can go to this individual.
Hi, my name is Maria Van Werkhoven, and I live in that area. The question that I had, I believe it was Madeline made a comment, or at least that's what I heard, that we have not detected, some of the symptoms that are listed. I know cancers are probably long-term results of this, but these chronic irritants, that are in the air with ethylene oxide, also cause more chronic symptoms such as those that are listed: headaches, memory loss, numbness, nausea, and vomiting. You say none have been detected. How have you determined? Have you done surveys? Because, with those kind of symptoms, most of us don't bother going to a doctor, or if we do, there's no community collection of that data.
Right, so I can take a chance at answering, but if Shelby County has some additional thoughts, that's great. So that would be a great way to get a better sense of what's really going on in the community. The way we're looking at it is actually sort of the opposite direction. So we have some knowledge based on research that's been done by the National Institutes of Occupational Safety and Health. And that's what goes in to sort of like help us understand at what levels you might see different types of symptoms and different types of risks. And the levels that we're seeing in this community are not at the level that is associated with that from the research that we've done. But that doesn't mean that it's absolute. And if you feel like you have those concerns, I think we want to hear about that. And I don't want to speak on behalf of Shelby County, but I know we want to hear about that. So definitely reach out to us, and maybe I'll pass it to Michelle now.
Yes, ma'am, thank you for that question. You're exactly right. A lot of times the symptoms from irritants are things that folks in the neighborhood wouldn't necessarily report, but that's why we have initiated the cancer incidence study, because we really want to know, starting with just the risk of cancer overall in the affected area, what that is. And then we can work backwards from there and really start to investigate what else is going on with the neighborhood. But the first step is to really prove that the elevated risk is there and that we've seen it already, and to look at the data. And then we can go from there. But that's where those community resources come in too. Letting people know that they shouldn't ignore, folks shouldn't ignore when they're ill anyway, but they definitely shouldn't ignore any symptoms that they're having. They should reach out to some of those community resources that were listed or their own personal provider and start to investigate what may be going on if they have those long-term chronic symptoms.
This is a good place to,
Can you get that mic back?
sure. I don't know, do we have ATSDR on the line, or should I just, maybe I can try to speak for them for a second,
I'm
but.
gonna turn this mic on too, so
Okay,
then
sure.
you guys don't have to turn one on too much.
Okay, good.
But,
Michelle's on.
oh, Michelle's on. So Michelle, I don't know if you want to speak to some of the resources that ATSDR has for folks related to conversations with their doctors.
Great, so Kyle, can we get Michelle pinned up here on the screen alongside Miriam? And then, great. Michelle's got her camera on over on the left. Perfect. Okay, and Brady, can you unmute Michelle? Okay, so we may be having some technical difficulty with Michelle being able to talk with Madeline. I know we've had many conversations with Michelle about some of those resources.
I'm gonna do my best. Michelle's eager, and she can maybe if we can get her on later, then she can we can't hear you, right? Okay. So there are two resources that I would point you to on the ATSDR has developed. One is called Chemicals, Cancer, and You. And it's for sort of more general information, but it gives you a lot of good background. It's not as specific to EPO, but it would help you understand how chemicals can cause cancer, and what it might sort of like look like in context. The other is specific to ETO, and it's called the Eto Clinicians Brief, and we can get the link for you, if we might even have it on a slide somewhere, but we can get the link for you before you leave today. And that resource is more intended for a doctor, but if you feel like your doctor is not going to listen to you, or if you feel like you don't have a doctor that's sort of understanding of this issue, you can suggest that they access that. You can even take it with you, and it's a good introduction to the issue for a doctor who may not be super knowledgeable about it, but it covers all of the symptoms, not just cancer. It covers potential outcomes from higher exposures as well as lower exposures, and if you think the levels in your community are high enough that it might cause some of these more acute issues, that's an important thing for us to know. So please do report that to us, and we will try to elevate that in the way that it needs to be elevated.
Thank you for the question. Let's take a couple more in the room. I think I saw multiple folks standing up, and I'll make sure we get the all.
Good morning.
And thank you all for coming out and releasing this information to us. I have so many, I'm all over the place, I'm trying to narrow it down. But through this morning's presentation, I continue to hear reduce versus eliminate.
I'm gonna move this mic up just a little bit for our folks in the room so they can hear you, if that's okay, man. There you go. All right, thank you so much.
I continue to hear reduce the emissions at the plant versus eliminate the emissions from the neighborhood. And that's really where my concern is. I understand the need for the sterilization use. I understand that people need jobs that work there. And I also understand the risk of the community, the residents. And it looks like these neighborhoods, urban neighborhoods, Black neighborhoods are chosen as neighborhoods to put chemicals or release chemicals in. That's my impression. And rather than have that, why can't we find an area for these companies to work. They need to operate, I understand that. But why can't they operate in areas that have less risk to residents? And so I'm not hearing much about elimination, the reduction, because since 1973, 76, or 85, however long they've been doing this, we don't know how many people we have lost. We don't know how much cancer or whatever has been caused. As you were talking earlier, I was thinking about, what about the days I come home and I just have a headache? All of a sudden, is that where that came from? I don't know. You don't know. So what is being done? I know we have the laws are not in place now; they're being worked on. Okay, but still, what is being done to eliminate? As opposed to reduce?
Let me first say this, and thank you for the question, first of all. When we talk about eliminating risk, the pollution control technology that exists today, I must say that the most efficient one and most effective would only guarantee us a 99% efficiency rate as far as removing pollutants from that airstream before it goes in to be released. And so that's why we use the term reduced, first of all. But as far as, you know, the facility being located in a different location, unfortunately, that's a zoning, you know, issue that would have to be addressed by the local government. You know, and I don't know of any additional information that's, you know, out there right now about the facility. So what I can do is, you know, ask Dr. Taylor if she's aware and let her share any additional information that she may be aware of as the permitting authority for that facility.
Thank you for your question, and I do understand your concern. My parents grew up in the area that's affected, and my grandparents had homes there, and I still have family there, so I get it. What I can say is this: we already know the history, the environmental justice history of our county. We understand that there are several facilities in this area that have question marks, make people wonder about how those facilities are affecting their health. We understand that. And your questions are valid, more than valid. If any of us had to be dealing with what you're asking, we would be concerned too. And I can tell you that the people who are sitting up here, the only reason why we don't say eliminate is because we don't want to be disingenuous. And let me tell you what I mean by that. It would be irresponsible for us to sit up here and say eliminate when we understand that there are so many things that we come into contact with, not just ETO, but other substances in our air and in our water. And so we know that all things come with a modicum of risk, but what we are telling you today in regards to ETO, that everybody up here and everybody who's been working on this problem and everybody who gives permits in this county and everybody who deals with the federal regulations are committed to reducing as much as possible the risk to ETO and other substances that we encounter. We are committed to that. But we also know that there are a lot of things that go into that. It's not just the permits, it's the zoning, it's the type of businesses they are, it's the fees, it's all of those things combined. So we do understand your concern, I understand your concern, and that's the only reason why we don't use that term.
So with reference to zoning, then I guess that brings in our politicians that represent the areas. Why? They should be on the panel with you. Yeah. I shouldn't have to miss my line dance class to come and sit and speak. and I knew I would have to. You know, I have to modify my schedule, which is okay, I'm glad to be here. But, when EPA contacted Cervical County Health Department, knowing that zoning and all these other things come into place, those people should also be here. So we really want to have some representation, some total representation. That would be good. I would feel better about the things that you're trying to do if I saw all the people that you need to be working with here with you.
That is a fair assessment, but what I can tell you is that as a representative for not only Shelby County Health Department, but Shelby County government, there are many people that are already aware, that I talk to on a daily basis, that ever since we knew from the EPA that this was coming, and the EPA committed to being here on the ground to make sure that we were addressing some of these concerns and starting the process of making sure that these regulations are more stringent. These folks that you're talking about, the elected officials, have been aware. The other thing I want to do to give them just a bit of grace is that there is another meeting this evening. And so, you know, I'm sure that some of our friends at the different media outlets will probably cover this particular exchange, so get ready to be a star. And I suspect that you will see more of our elected officials in the audience this evening.
That would be great.
Yes, ma'am.
Could I add just a little more on solutions too? So this is sort of back to what you were talking about in the beginning, but you know, I mean, this was also an important exchange. But I think it's also worth noting that there are solutions that do get risk down to pretty close to zero, right? It's not, I mean, we are never going to say eliminate, right? And we're never going to say zero because we are a scientific agency and we want to reduce as far as we can. But there are places that controls have been installed and we've seen risk come down dramatically. And so that has not happened here yet, but there, I mean, those solutions really would, I think, make a big difference.
I heard the numbers, I understand stats, and I've also seen where 10 years later, the stats are much worse than what they were predicted to be. So
Yep.
the numbers just, you know, I just weighed up. You know, I just want to see something done that makes me feel more comfortable for me and my neighbors. Just so that we can, you know, live our best life and that without an aid of the neighborhood facility. That's it. Thank you.
Thank you. Thank you very much.
Thank you for that question. We will take a couple more from here in the room, and then we'll rotate to some we've gotten online. Go ahead, sir.
Good afternoon.
Good afternoon.
You talked about where you could go to be part of the study for breast cancer and cervical cancer. But where can others in the community go to be part of the study when it comes to the other cancers?
So let me be clear. The study actually looks at people who we've already lost in the community to cancer, to specific cancers that we know folks are at higher risk of from ETO. The resources that I put on the screen are not to be involved in the study. Those are resources just if you are concerned, or if you just need a primary care provider to check out and make sure that you're doing okay. You can encounter those resources, you can go to those physicians and those nurses and be seen. But actually, the study looks at data from people that we've already lost to cancer and sees if we lost more people to cancer in this particular area versus another area of Shelby County. And that's how we assess if the risk is higher in the areas that are affected by this particular facility.
Can I?
Yes,
Type of cancer.
From EPA's perspective, I mean, cancer cluster studies are really important for us to understand the degree of risk and sort of verify. But also from EPA's perspective, like if we actually see a positive result in a cancer study, we haven't done our job, right? Because our job is to protect your health. And so we're moving forward with all of this, trying to get these reductions, trying to make that risk get as close to zero as we can, regardless of what the study says, but the study is very important to help understand, and for you all to help understand how it plays out for you. Yeah. Thank you.
Hey, good afternoon. Let me first of all apologize for missing the meeting. I almost missed it, but I need to know this. Where can my neighbor that has never smoked,
So can I get that mic just a little closer to you?
that has never smoked, period, just recently, she's on oxygen now. I need to know, where can we get her at? Because she's a widow woman, she lives by herself, and all this is taken care of. We live just a block away from the refinery, a block. My wife, my daughter, both have issues with breathing. Since we've been in here about 15 years, but I'm just trying to figure out how to help my neighbors. And what can I do to help her? I mean, you all have been.
So, this is on or not. So what I will say is, there are a couple of questions I have to ask, so I have to go into physician mode for just a second, so forgive me. The first thing to ask your neighbor is, does she already have a provider? Somebody who's seeing her for her current issues. If she's on oxygen, I'm guessing, I'm assuming things, that she already has a provider who is providing care. And then, once you get that question answered, then the question is she getting everything she needs from that provider? Or is it something that requires a higher level of care? Once again, I'm stepping into my physician shoes now and out of Director of Shelby County Health Department, okay? But those are the two main questions when we're talking specifically about your neighbor that need to be answered first. Now, past that, when we go back to ETO and whether that is the cause of her current issues, that's not a question that I or my fellow panelists could answer at this point. But what I will tell you is that the most important thing is that your neighbor is getting the care that she needs. And if she isn't, there are community resources available to make sure that she's able to access that care. And we can talk about that offline after this Q&A session if you'd like. Yes, sir.
And sometimes we do hear from folks in the community that doctors that they go to maybe don't understand the environmental health side of things. They don't understand the sort of chemical potential exposures. And so I think there's resources in Shelby County, but then there's a different set of resources that may also be helpful. And there's a pediatric environmental health specialty unit that could also give they're focused on pediatrics, but they really are environmental health experts in the regions. And then there's also the resources from ATSDR that I mentioned earlier.
And I know Michelle wasn't able to come on the room, but if you just Google ATSDR Clinicians Brief, ethylene oxide, then you'll find that link. We can also make sure to get that linked on our ETO website.
Could someone get a comment card to the gentleman in the back though, so we can make sure that we get his information and we send him the PACU information as well?
Thank you. We will take two more in the room, and then we're going to rotate to those online to make sure we give everyone an opportunity. Thank you.
I have a question regarding the company, SST. Did you say that the company is in compliance? Okay, if so, what effect does that have moving forward on the community? Is this an empowerment session where we're just discussing and a percentage of people in the community, mostly Black, that are now plagued with cancers, and we don't know the percentages? Are we allowed to know what the community looks like as a whole because of the pollution or the problem? Do we know how many? I mean, our elders in the community are dying or dead, and so any young person moving in the community, that's what we're concerned about. What does this look like moving forward? The company is, we don't see, so the company is not going to change anything.
Could I start with the national level piece, and then because you guys know the local thing, and that's probably the more important thing. But so on a national level, I can imagine it's really frustrating to hear the risk is too high, and yet the company's in compliance, right? It seems like a major disconnect.
Correct.
And the reason for that, and Caroline did explain this earlier, but the reason for that is when we made the rules, we didn't know a lot that we know now. Specifically, this chemical is a lot more toxic than we thought it was. We learned that it's maybe 40 to 60 times more toxic than we thought it was when we first made those rules, which is a huge difference. And we also have learned that we also didn't realize that commercial sterilizers themselves were such a source of risk, and it's because they tend to be in communities. And so we realized that. And then we also realized that fugitives, as Caroline covered in some detail, that fugitive emissions were a much bigger deal than we thought before too. So our regulations are not protective enough. The rules are not good enough. And so some facilities have changed on their own before the rule's in place, but they will have to change once we get the rule in place, and hopefully they won't wait that long. But that's a national level perspective, and I think there's probably more on the local level that you guys could share.
So, like you said, it's super frustrating to hear that they're in compliance, but we're talking about this elevated risk, right? So this public comment is part of that rule changing process that the EPA has to go through to make sure that changes do occur at the facility, given the new information that EPA has done. So a lot of times, especially with agencies like the EPA, that's why the data is so important. And Ms. Freeman went over that, because when we know better, we do better. So they have data now that lets them know that ETO is more toxic than they knew when the law was first written, when the regulation was first written. So now we know that the regulation needs to be changed. We know that more controls need to be put in place. And like Ms. Freeman shared earlier, if it's a new facility, they will immediately have to comply with the new regulation, immediately, before they can even open their doors.
So they don't have to comply because they're grandfathered into it?
No, that's not what I'm saying. That's not what I'm saying. So I'm gonna go back over what she said. For existing facilities that we know the rule is about to change, they will have a period of time to come into compliance with the new regulation. So, and the EPA, right now that period of time is 3 years, but the EPA and the folks that you see sitting right up here will be fighting to make sure that that period that they have to come into compliance with the new regulation is shorter than 3 years. Because we understand 3 years is a long time, right? That's the current rule. But the good thing is we have people here on the ground, and we have all of you all engaged, and I'm sure we'll have an even fuller house this evening. Make your voices heard about the fact that not only do you want this regulation changed to reduce the risk in the community, but you want that those changes be made sooner than 3 years from now.
I just have a question for you.
Yes, ma'am.
Because you are very much aware of the community's needs, is there anything you can do as a bridge between the community that's in question, and we know that it's dire, it's a major problem because EPA is here? I mean, we don't know partly what's going on. You know so much more, we realize that. But can we appeal to you to set up some kind of program to at least identify people that may have a need to come in and be a liaison between the local community and this area that may need to see a doctor that normally would not do that? There's got to be something. And I would say, Ms. Caroline, could you give us a copy or show us where to go on the website to get a copy of your information?
You want to answer first?
Sure. So I'll say it in the shortest way possible. Done.
Good.
And it's already happening.
Good.
Okay? So that's already happening.
Okay, good.
Okay, and ma'am, I'm gonna second Dr. Taylor and said, done.
Good.
Okay, so by tomorrow, well, let me at least give myself 48 hours. Because I want to make sure that I stay honest. 48 hours, it will be there. Thank you.
And Todd, can you go back a couple slides where we post the name of the website? You can take a screenshot of this, but this is where we're gonna post these slides. So I'll keep going back, and I think it may even be one of the first slides that has the website, epa.gov/ETO/Memphis, I think is what it is. And it's also on the fact sheet, so if you have one of these, the website's listed up there.
Yeah, we have more copies of those in the next room.
And there's a lot of other information on the web too about how to be involved in a public comment period, because that is not the easiest thing to learn how to do. There's information on there about how we did this analysis. Really everything that we covered today, you can find some more information online about the process as well.
And just to add to what Madeline just shared, guys, there will be a fact sheet that the agency will prepare as a result of the proposed rules coming out, just to give you a more summarized version of what's in the proposed rules. And I'm going to have my staff to take a closer look, even at the fact sheet and the proposed rule, to see if there is anything additional that we need to bring forth to your attention. And I commit to you today, and I will be working very closely with Dr. Taylor. And if we need to come back and just summarize the rule for you, once it is proposed, we will do that. Okay? And I see my regional administrator giving me a thumbs up, so he's holding me accountable. And I'm gonna give you one of my business cards, ma'am, so you can hold me accountable too.
Thank you. We'll take one more question from the room and then go online. Go ahead.
Hi, my question is, I guess, directed to Dr. Taylor. I understand the EPA's sort of regulatory approach to, being proactive about this, and I appreciate the information about the comment period. It's really great information. I guess my question is, given that the health department manages the pollution division, and they're responsible for air quality management, and this is within compliance, but if you could speak to what they're doing to help this effort, either from a regulatory perspective or perhaps more proactive. People are dying from cancer because they're leaving their doors open when they're loading trucks. It seems like there may be more proactive steps that can be taken here within Shelby County that might be feasible, or is there support to that regulatory campaign that the EPA is pushing? What is the pollution division doing to help that?
Great question. So I'll push back just a little bit. I would submit to you, I've been in this role a little bit over a year, but I worked at the Shelby County Health Department before. And I can tell you that the Air Pollution Division has been proactive throughout the years because we are the permitting agency for the county. So that's the first thing. So we have dedicated professionals who go out every single day to make sure that air pollution levels are not out of control in the county. Now, I do understand that there has been a lot in the media recently about our air pollution division, but please understand that some of the things that we are experiencing now and that you're hearing about were findings that were found long before your present leadership team at the Shelby County Health Department back in 18 and 19. And as soon as this new leadership team came in, we've been confronted with those issues, and we have taken those on head on to make sure that our air pollution staff, and frankly, all of our staff, have all of the leadership support and all of the tools necessary to be successful. So what does that mean? That means that the chronic understaffing that we've had in the air pollution division, because I'm pretty sure that that's what we're getting to, we are trying to address, not only with salary increases, but also with bonuses, and making sure that we get high-level professionals in those slots. I think everybody can attest to the fact, no matter what business you're in, is that we have had a great resignation. We've had a lot of people leave. We've had a lot of people get poached into the private sector, because one thing that some folks forget is that it's harder to hire within government because we don't usually pay a market rate for the same services. The other thing that we're doing on the Shelby County Health Department side is making sure that we contract some of the work out that needs to be done in the immediate to make sure that the public's health is protected at all costs. Now, I know some folks don't like to hear that we're using contractors, but we have to do what we have to do in the immediate to make sure that the work is getting done, because, as you said, folks in the community can't wait. They can't wait for me to be able to hire a highly technical, skilled professional and then get them trained and then make sure they go out and get the work. So we're gonna make sure that people who are already trained to do this work do it in the immediate so that we can continue to protect the health of everybody in the county.
All right, so we've got a couple dozen questions online from our online community. I want to ask for our folks that are online, if you have not typed a question into the Q&A module, please go ahead and do that. If you are on the phone, specifically if you called into the Zoom meeting, then please hit *9 on your phone, and hopefully we can unmute you and let you talk here in the room, but *9 if you're calling in. So first question, Caroline, someone wants to know, can ETO permeate a house if the windows and doors are closed?
Taylor, thank you for that question, first of all. As far as ethylene oxide is concerned, the more concentrated levels of major concern is closest to the facility. And I will say that as you move away, excuse me, from the facility, the risk decreases rather significantly. And with that being the case, we're talking about ethylene oxide emissions that are escaping a facility, but I want you to also know that ethylene oxide exists in the environment as well.
Carolyn, I think the other part of the question here is basically trying to get at, is it safer to be indoors or outdoors? Like, let's say you live near one of these facilities, would it be better to stay inside or be outside? Or does it matter?
You know what, to be honest with you, in answering that question, ethylene oxide in the environment, when you go out in the air, the concentrations are not at a significant level for an acute reaction. Also, being indoors, as far as emissions in the house, we've not done research on that to know what those levels would even look like inside of someone's home. But from walking outside, we're talking about a modeled risk that we're sharing today, and that's a long-term risk, not an acute risk. So for someone just walking out into the environment, I don't foresee any major reactions to the ethylene oxide concentrations that we have noticed here in this community.
Madeline, this one may be for you. We have another individual asking if we can provide more details on the statement that ETO is causing health risk in the community. What do we mean by it is causing health risk?
So I think, I think the question here might be on the definition of risk. So, because I think sometimes there's a question between if it's not causing an outcome, is it causing a risk, right? And so risk is like if you roll dice, right? There's a chance that you're going to get a 6 and there's a chance you're going to get a 1, right? And so there is risk in the community. We can't verify yet that there are outcomes that have been caused by ETO, and that's part of what the cluster study that Shelby County is doing will help tell us. But we know enough to know about the levels of ethylene oxide coming out of this facility to know that it is causing a risk, like a chance.
This one I think might go for Shelby County. Are there any confirmed cancer cases that we could say this did happen because of ETO?
No, not at this time. And even when we do the cancer incidence study, it will look at a broad group of people who passed away during a certain period of time and live in that area, and compare them to another broad group of people who passed away from cancer during that time period in another part of the county. So we will not be able to pinpoint specific individuals that have developed cancer in the area.
So we have another question, and maybe Madeline, just to go to you. The question is, you know, this whole time we were talking about reducing risk, we didn't say eliminate, but the question was, you know, when we say that, does that mean that we are going to reduce risk to a safe level? And if so, how do we determine what a safe level might be?
Safe is a word that's hard for us at EPA to talk about, because it is something that has a lot of personal to it, right? So what I consider safe may not be what you consider safe. So that the levels that we use at the agency, as Caroline explained, is really sort of as a benchmark for us to decide where to focus. And so that level that we tend to focus on is 100 in a million. So if someone is exposed for 70 years from birth to age 70, 24 hours a day, 7 days, 7 days a week, would 100 of those million people develop cancer? So that's like the level that we look at from like where we focus our most efforts. But ultimately, like, we're working to make the community safer and as safe as we can with the solutions that we have available. And I should note that just because 100 in a million is sort of the level that we use to make considerations for where we focus most of our efforts, we are focusing our efforts to try to get reductions for everyone, even at facilities and locations where the risk is a little lower, and even outside of the light blue area where risk might be a little lower, we still want to make sure that that number comes down as much as possible.
Great. Going back to that question earlier that I'd asked about the indoors versus outdoors, the same individual.
Just a reminder to please slow down for the capture.
Great. So the question was, a follow-up question from that, from the same individual is, can ETO penetrate walls and windows?
Do you want to? There's not, so I mean, I'm going to summarize what Caroline said before, but there's not a lot of science on the indoor versus outdoor that we feel confident in. There's a lot of questions, and I can tell you what some of those questions are if it might help. But there's a lot of questions about potential sources of indoor ETO, which could be cigarette smoking. We believe that indoor cigarette smoking is associated with higher levels of ETO inside. But it also would depend on all sorts of things like your ventilation, you know, how secure your doors and windows are. I mean, it's a gas and it can get places, and most of your air filtration systems. So if you have like a really great air filter, it's probably not going to do much because it's a gas, it's not a particle, and most HVAC filters are designed to take out particles. I don't know if that's helpful additional information. I kind of just repeated what Caroline said earlier, but.
So following up on, kind of related to this, and this Madeline, I think this might be for you. Is there another sterilizing product that could be used by this facility or any of these facilities outside of ETO, instead of ETO?
You want me to?
Either one.
So we're working with, I'll start, and if you have more, you tell me. I'm sorry. We're working with FDA because, so EPA's space really is looking at how much risk is coming from a facility that uses a chemical and trying to reduce that risk. FDA's space, the Food and Drug Administration, is trying to make sure that if something is used in a hospital, that it's safe for use, right? So if you're gonna go get an IV tube at a hospital, you wanna make sure that IV tube doesn't have a fungus or a bacteria or a virus living in it. And so we're working closely with them to figure out what solutions there might be that are not ETO, or if there are methods that you can use ETO but use less of it to achieve the same result of making sure things are sterile. The challenge is a lot of the things that we have a very developed medical system, and a lot of the things that doctors use either are very sensitive or they have electronics in them. So if you can't just like boil them, like heating things works really well to sterilize them, but some things you can't just heat. There is something called vaporized hydrogen peroxide that's being explored in some cases, but there is a sense that ETO is needed for some products at this time. Do you have more? I'm sorry.
The only other treatment process out there to sterilize these types of devices would be gamma radiation, and several of them you cannot use radiation with in order to sterilize. So, you know, as Madeline said, we are continuing to partner with the Food and Drug Administration, and they have their research area that they are pursuing to see what other options are available other than ethylene oxide, because for the most part, a lot of these medical supplies are prepackaged, and therefore, you know, of course, steam would negatively impact the packaging and could potentially create mold development on the inside. of these devices, and that's not something, that we want to see, especially when we're talking about going into a medical or dental facility to, be treated, to be made well. That's definitely not a sign of wellness at all.
Great. So I do want to be mindful of the time. I know the room has dwindled a little bit here. We still have about 20 questions online. We're going to try to work through those, by being responsive, but do them a little quickly if we can. But just want to be mindful if folks do need to leave that we have these resources up here, and we will be posting these slides, and we're recording this, and we're going to post that online. So this might be for Shelby County. I've got two I'm going to try to put together for you. One is, when is the study going to be released? And the second is, for all those providers that you recommended, are they free, or is there a cost to go see those providers?
Both great questions. First, normally a cancer incidence study takes about 2 to 3 months to complete. And so whether it's done in 2 to 3 months or not, I will be back before the community at that time to let you know where we are with the study. But we're anticipating that it will be done at the longest in 3 months. Second, as far as free services, those are things that I am working with my different hospital partners on. Shelby County Health Department has a lot of those, as you can imagine, particularly after this post-COVID period. So we're working on that. But most of the time, the providers that I have put up there are either free services, or if they are not free, they have a sliding scale, or if they don't have a sliding scale, they will work with you to make sure that you can get those screenings. But we will have more to come in the coming days about additional resources that will be available to the community.
Great. Carolyn, this might be for you, maybe Madeline. Do we know when the new regulations for compliance are going to be put into place?
As it stands right now, Taylor, let me step back. First, please thank the individual for that question for me. Second of all, as it stands right now, we're looking at the proposed regulations coming out within the next couple of months. I know you're saying, what does couple of months mean? I don't have a definitive date, but within the next couple of months. That's why we're out making you aware of the proposed rule now. Hopefully you should see something before the end of this calendar year, or no later than the beginning of the calendar year. So with that time frame, I'm going to ask that you include an additional 90 days for a public comment review process. In addition to that, let's step out 1 year from that day to give the agency an opportunity to consolidate those comments, respond to these comments. And we're talking about comments that are going to be coming in, based on outreach that we are doing in 23 different communities. And that's where these high-risk facilities are. So it's going to take some time to consolidate all of those questions and respond to them, and ensure that we are taking those comments into consideration in the final rule. And thereafterwards, once that final rule is released, if it's a commercial sterilizer that is coming online after that final rule has been released, then that commercial sterilizer will have to comply with the rule immediately. If it's a commercial sterilizer that's already operating, then that window of compliance in the Clean Air Act as it stands right now is 3 years from that final rule date for that facility to come in compliance. However, as I said earlier, the agency is taking comments on that compliance timeframe, and we will take that into consideration.
Can I just add on the FIFRA? I'm sorry, I know I'm supposed to be short, I know, but just because that was all about the Clean Air Act rule. There's also this other part, we talked a little bit about workers and people who work near these facilities. It's called FIFRA, which is Federal Insecticide, Fungicide, and Rodenticide Control Act, because ETO is considered a pesticide because it's used to kill germs. So that law that rule is expected around the same time, so in a few months, to be proposed. They have a little bit of a different system under that law in terms of how long folks have to come into compliance. And for certain things, they can do it immediately, but it just depends on sort of how hard it is for a facility to achieve that goal, and they have to consider that when they make their decisions. So some of it could be immediate, but it probably will be faster than the 3-year timeline that is under the Clean Air Act.
Mal, maybe this is for you. Are there other sources of ETO in the environment other than just the sterilization facility?
The answer is yes. There is some growing science on this topic, but we still don't really know a lot about potential sources of ETO that are not man-made, not from commercial facilities like this one. I will say for the analysis and everything we talked about today, this was calculated, the risk that we're talking about is calculated as, and Caroline mentioned this, as the increased risk from that facility. So it's really the risk we're talking about today is the risk from the emissions from the facility.
Great. Another question is, should someone wear a mask? Would that help if they, not just someone that works in the facility, because that has different requirements, but someone near this facility, should they be wearing a mask?
There's not a lot of evidence that a mask could help with ethylene oxide. If you have other reasons to wear a mask, certainly do wear one, but masks really are designed to keep out particles and small things that travel in air, not gas itself. Most masks, you would have to have like the full thing that's like, this kind of mask, N95 is not gonna help much with ETO exposure.
Caroline, I think this one's for you. Did EPA require these facilities to provide annual ETO emission reports at any time? And were the sterilization companies required to track those emissions? And if so, what were those periods?
Okay, thank you again for that question as well, Taylor. First of all, we do have an inventory that we refer to as the toxic release inventory. Initially, not all facilities had to report to TRI because of their usage quantity. The administrator recently signed provisions early in 2021 that now require several additional, I think it was 19 additional facilities to report through the toxics release inventory if they are utilizing at least, what was that number? Is it 10,000 or 10?
I don't know off the top of my head.
I do believe. Do you remember what that number is, Sarah? I'm not 100% sure, but I will fact check what the new, quantity is, that if a facility is utilizing that amount of ethylene oxide in their process, then they would have to notify through or report through the toxic release inventory. But I will fact check that.
Thanks, Caroline. This question I think is also for you. When ETO dissipates from the atmosphere, how far does it travel?
There have been some studies on ethylene oxide in the environment, and what we have learned, I can't say how far will it travel. It depends on several different, weather predictions. And so, not having a meteorological background, I know I have some folks on my staff who do, but as far as how far it will travel, it depends on meteorological conditions as to how far it would actually travel. So that's going to vary.
Great. This might also be for you, Caroline. How do you measure the amount of ETO that is being released from the facility?
Well, the best way to measure the amount of ethylene oxide that's being released from a facility is by testing, because we're talking about controlled emissions. The ethylene oxide, and under the current regulations, but the ethylene oxide that we're talking about today that's actually coming from these facilities are not controlled emissions. Those are fugitive emissions. They're not being monitored. And so as a result of that, the best way to get a true picture of what kind of risk are associated with those emissions is to collect specific information from the facility, such as how much ethylene oxide they're utilizing. Not only that, but meteorological conditions, and like I also said, They've had recent, stack tests conducted so we can get those emission factors. And not only that, but take a look at the actual process itself, because each process is somewhat just a little different at these facilities. And when we take that information and plug it into our computer model, it better generates what that risk look like on the community. I know someone may be thinking, well, why isn't, EPA just monitoring? Well, I don't know if you saw the canister that Sarah had this morning, which is a SUMA canister. You can collect data with that SUMA canister, but what we've learned about ethylene oxide, the way how it exists in the environment for the most part, if we are monitoring right there at the fence line of that facility, there's a much better chance of us getting an understanding of what the ethylene oxide concentrations are. And that requires years of monitoring in order to do a risk analysis. If we step away from that facility, a fence line, what we're finding out is at those lower levels, the methodologies and the detection devices that we have available to us right now cannot detect it at the levels that we needed to get down to. And so that is why it's more advantageous for us to model this risk that we're talking about today, so that as we move forward, we got a better understanding of how widespread the risk is and what kind of control technology, because this is a hazardous air pollutant that we're talking about, and therefore the Clean Air Act requires that facilities of this type who are emitting that hazardous air pollutants put on the maximum available control technology that's out there on the market. And so in order to do that, we need to have an understanding of how widespread the risk is, so that as we are moving forward with the regulatory development and looking at the effectiveness and efficiencies that exist with these pollution control technologies that are on the market, that we are incorporating into our regulations the most stringent or the maximum available control technology to reduce this risk that we're talking about today.
So I've got a couple questions for Shelby County. First, are there air monitoring stations in this area?
There are air monitoring stations in the area. In our county, there are 5. I'm looking at my administrator. There are 5 throughout the county that monitor all manner of things, not just ETL.
Great, and then will there be research to look into how air quality near the facility is affecting respiratory health? Or maybe it contributes to other health issues outside of cancer?
All great questions. So we are starting with the cancer incidence study because that's the one, frankly, that is the gold standard for this type of question. But when you start getting into respiratory symptoms, different conditions, it gets a little bit more sticky with the data. And I'll tell you why. Because then you have to go outside of what we're talking about today, which is ethylene oxide. And you have to think about and take into account all the other substances that may be in the air. And then, just like Ms. Freeman has been discussing, you have to take into account weather patterns, the patterns of people moving. People don't always stay within the neighborhood. So it makes doing that type of research much more difficult. Not impossible, but much more difficult. So we want to start with the cancer incidence study and then see what information that bears out. And then we'll be able to decide what other studies need to be done.
Caroline, going back to the data that's been submitted by the facilities. So just to clarify, was the facility required to begin collecting data in January of 2022?
Thank you for that question, Kayla. The facility was not required to start collecting data in 2021 or 2022. This facility has an obligation to maintain its emissions information from the date they started operating. When we requested the information, we actually sent the information request to the facility in 2021. That was the first one. All facilities that we sent that information collection request to did not respond. Okay, so
Carolyn, can I stop just real quick to ask a clarifying question? So just to make sure that we're understanding it, facilities are required to collect their own data about their own emissions, but they don't necessarily have to submit that to EPA. But then we send out a request saying we want to get that information from you.
They're two separate things.
Okay, we got two different things going on.
Yeah.
Okay, facilities are required to maintain information about their operations. And so I hope I'm not stepping in your lane, Dr. Taylor, but on the compliance side of the Clean Air Act, this is a record-keeping requirement. Okay, and so that record-keeping requirement must be met. So when the folks from Dr. Taylor's office go out to that facility, or not in my program, but from the compliance side of the air program, folks from EPA come out to the Memphis area and go to the field with Dr. Taylor's staff. That information must be there in order for them to take a look at past compliance history. If they don't have it, then that's a record-keeping violation, and there are penalties associated with that.
Great. I think that's answered this question to this individual, but if there's follow-up, please submit that again, and we'll ask that. We've got a little under 10 questions left in here, so we've got time if we didn't clarify that. So,
excuse me, Taylor, can I respond to the fact-checking that I said I would do? Okay. As far as those facilities that are required to report to the toxic release inventory, if those facilities utilize at least 10,000 pounds per year, then they must report to the toxic release inventory.
So the next question kind of comes to this accountability piece. So what is being done to hold companies responsible, even if they're complying with EPA regs? And then there's kind of a separate question from a different individual saying, can the company be sued? Can we talk about any sort of, Matt, maybe you can take a stab at it.
I can take a national level, and then if, I don't know if there's any
advice that you would offer regarding litigation?
So I don't know if this is regarding litigation, but let me start just with like working with facilities and or holding facilities accountable, because it is sort of a double-sided issue. In many cases, facilities, what we're really asking of them is to take some voluntary steps at this point, because we want them to reduce risk faster than the rule is going to require them to. And so that requires a certain amount of partnership. And there are many facilities around the country that have worked with us to understand where we're seeing risk and are taking proactive steps ahead of a rule at great expense to try to reduce risk, because they are committed to trying to protect communities. At the same time, we have also heard from many facilities that as soon as they know what the rule is, they're prepared to take action faster than the regulatory timelines we've talked about, but that it is an expense to make these changes at their plants, and they want to make sure that when they make those changes, that they will be in compliance with the new rule. In terms of litigation, we typically don't speak on litigation, because those are issues that sometimes if we speak on them, we actually can jeopardize any litigation efforts. So we have 2 offices at the agency that deal with issues like lawsuits, and they don't like us to say much, because they need to have the most freedom to do their work. But if there are specific questions, we can refer you to those offices, and there can be more of so I don't know if we can collect more information or if we need that.
Great. Malin, maybe you can take this one, although maybe Shelby County. So who is responsible for protecting a community from the cumulative impacts of ETO or other air toxics? Who is that? Shelby County? Is it EPA? Is it everyone?
Well, let me start, and I don't know, maybe we could even call Daniel back up for that, but then you can talk about what's going on here. I want to say that, like, there is a real understanding, and Daniel Blackman spoke to this earlier, The cumulative risks are a big problem. And when we say cumulative risk, maybe I should even say what that means, because I'm not sure that everyone is familiar with that phrase. What we said at the outset, we're here to talk about ETO and the risk from this ETO from this one specific facility. But we know there are other risks in your community. We know there are other sources of risk here. And those sources of risk may actually impact each other, right? Like perhaps there's a refinery and there's particulate matter from that refinery, and that irritates your lungs, and perhaps then when you breathe it, we don't know a lot about that science, but there is this like theoretical possibility, and we know enough to know that it does happen when you are exposed to multiple risks. Then that's where you get really bad health outcomes. The challenge is the laws that we have as an agency, as EPA, tend to be chemical by chemical, one at a time. And there is a real push in this administration to think about those things differently, because we understand that it's not a coincidence that these things tend to end up in the same neighborhoods, and that the folks that deserve the most help are often the folks that have the most types of exposures. But it does require some rethinking of how we do things, because the laws that we're following often don't think about it in that way.
Great. Do you want to add anything, or is that?
The only thing I would say is that to remember that Shelby County Health Department, while we are the permitting agency, we release those permits and provide those permits to industry based on EPA standards. So really, Madeline's answer is spot on.
Great. So we do have a question about permitting, the transition there. So since Shelby County is a permitting party with the air program, and we know that there's a risk, could Shelby County reconsider or withdraw the permits to the facility?
So we were ready for this question as well. Because the industry is in compliance based on EPA standards, we don't believe that we could revoke that permit, but this is one of those times, just like Madeline said earlier, we have to be very careful, because we do not want to jeopardize any legal issues that may arise. So right now, we issue permits as the county permitting agency based on EPA standards and regulations. And this particular business has been in compliance based on the current regulation.
This might be for you, Caroline. There was a question asking, where is the company disposing of the gas emissions that the question says that they harvested, but I think the question is, when you capture those in the control system, what happens to those emissions before the rest of that gets released in the air?
Okay, thank you very much, Taylor, for that question. For the most part, the controlled part of the facility, those emissions can either be scrubbed out in an acid wash, which is a scrubbing system, or a dry bed scrubber system where you have absorbents that actually absorb the contaminants into it, and then it has to be properly containerized and disposed of once the life of that particular absorbent expires. And that's when you're tying into a whole different set of regulations under the RCRA umbrella, which is a set of another regs.
Great. This is probably for Shelby County. The question is, you mentioned the 5 air monitors that are set up in Shelby County. Do any of those air monitors monitor for ETO?
None of those air monitors monitor for ETO. So like Ms. Freeman shared earlier, monitoring for ETO is very challenging. And mainly because, like she said, if you are right on the fence line of a industry that is emitting ETO, you can get levels, but that's over a series of months and years. But as you move farther and farther from the facility, and I'm looking at Casey again, because it is so heavy, it is harder to get those levels because they've already kind of settled down. So no, none of our air monitoring stations monitor for ETO. And the type of air monitoring, because we did ask this question as we started to go through this process and preparing for our partners to be here on the ground, we asked them, well, can we go on and get a monitor and put it there and be ready, right? And they said, actually, the monitors that are on the market right now just aren't sophisticated enough to pick up ETO at the levels that we would need to be able to assess what's really going on with ETO. And so really, the information that we get from businesses that emit this, along with what we collect right there at the fence line, are our best defense to know what the risks are and how to reduce them.
If I could just summarize that in a slightly different way too. Communities often want us to be able to put a monitor out to tell them they're safe. Scientifically, we can't do that right now. ETO is really hard to measure because of the nature of the chemical itself. But we're working on it, our Office of Research and Development is funding a number of projects, working with industry that is trying to develop new ways to monitor, new sensors that can monitor different methods. So we are aware that that's a problem and that's something communities want, and we're trying to invest in the science to get us there. But it's just fundamentally different than something like PM 2.5, and oftentimes people are familiar with those types of monitors because you can get a little thing, you can put it like outside your house, purple air. Those types of air monitors have become very cheap and accessible and available, but those types of monitors are just never going to be able to monitor for ETO.
Okay, we got just a couple more here. How much ETO has been detected or measured in the community? Has there, I guess that kind of gets into that monitoring question. Has there been any ETO?
There hasn't been a monitoring study here, has there? No. So we haven't had one here. Just to add a little context, I know we're trying to get through the questions, but one of the reasons that we are confident in the model is because the model has been validated by monitoring elsewhere. So there have been monitoring studies in some places, and we have been able to see that it really is reflective of what we've seen. But like the two things validate each other, and that's a way to know that you think you've got it right. For example, one of the reasons that we know fugitives are such a problem is because it wasn't just from the model that we learned that, it was also from monitoring.
Right. And then the other question is, has there been any testing related to fugitive emissions at this specific facility? Like, how do we get to that 87%? I'm kind of implying here, but I think that's the question.
Yeah, I don't think we have any monitoring data, but.
Thank you very much for that question, Taylor. No, we do not have any monitoring data. We got to that 86, 87% through modeling the emissions that we collected from the facility.
Great. And then there's a couple questions here, and we got one in the comment card and one here, and it's not really a question, but there's a lot of people that were frustrated that this took us so long, both as partners and as individuals, and so I just want to pass that along, that there were definitely some questions and frustrations about just the length of time it took us to get here. And I'm not sure if this is a good place to wrap it up, but I know we have our key points, but maybe just speak to, why it took us so long and what we're going to do moving forward.
First of all, let me say thank you also for that closing question. And I must say that, I agree, it did take us a while to get here. And the reason why is simply because ethylene oxide is such a complicated pollutant to measure. And now that we have a better understanding of this pollutant, we know what steps we need to take now to move forward as far as reducing risk in this community as well as the other 22 communities across the country. With that being said, we're continuing to work through our Office of Research and Development to be able to come up with detection methods that can get down to the level that we need it to get down to in order to better monitor for ethylene oxide. But in the interim, we're utilizing the best science available to us right now, the best technology that we have available to us, which is the modeling tool. And we're continuing to work with these facilities to see if there's any voluntary steps that they're willing to take to move forward. We have a number of industries out there that have reduced the risk associated with their operations. And so we know that this can be done. And so one of the things that we are committed to doing is working with our co-regulators at the state as well as the local regulatory programs to interact with these facilities, those that will partner with us, and take that step to move forward with voluntarily reducing their emissions until such times that the rules are finalized. But let me say this new rule that EPA is proposing, it's not just geared to these 23 commercial sterilizers that we have modeled for high-risk water. This new rule actually will even reduce ethylene oxide emissions further at those that do not fall in that high-risk category with the pollution control technology that will be required to be installed. So it's this pollution control technology that will be incorporated in the new rule or the more strengthened rule that will cover all commercial sterilizers across the country, that 100 facilities that we mentioned earlier.
Thank you for that perspective, Caroline. Any other closing thoughts? As we reach the end of the questions online, I believe, and here in the room.
I mean, maybe I'll just go back to what Daniel said at the beginning. It's really important for us to be here to hear from you. And it's really important for us to hear from you in the rule. So if there's anything we can do to make that easier, let us know. We know it's not always an easy process to be a part of government rulemaking. But we think that you all deserve to have the risk levels as low as possible, and that we're going to get there if we have that proper public engagement.
And I just want to echo what my fellow panelists are saying, but also speak directly to the community from a local perspective. We understand that this is scary, this is concerning, this is not something that any of us want to hear. I will tell you that my staff and I have been grappling with this since we got the notice from EPA and doing everything we can to not only start to address this at every level possible, but also make sure that we are communicating with you all in real time going forward to make sure that we're working together. So I would ask all of you who are still here to stay engaged, hold us accountable, continue to ask the pertinent questions, and continue to push us and our partners to do all we can to reduce the risks to the community. I really do appreciate your engagement thus far, and we can work together to get this better.
Thank you, Dr. Taylor. And we'll move to the very, very last slide of our presentation that we were concluding. I want to thank everybody for coming today in person and virtually, for your great questions, for bringing us your concerns. We will follow up with those that we couldn't answer today online. Just to recap and to close out, we're going to be posting these slides again. We will be sharing the recording once it's ready. We've got all the transcription done for the Memphis ETO website, which is epa.gov/ETO/Memphis. So sign up for the updates for any new information. Again, we're going to commit to keeping you all up to date on any public comment periods or any ETO rulemakings that EPA has going forward. I want to thank our partners who joined us today from the Shelby County Health Department, from the ATSDR. We couldn't get them virtually, but we did have Sue here at our open house, so thank you for joining us in person today. And again, we're having another session tonight, and we're going to come back and learn more, and we will maintain our web pages and also sign up for email updates. There's multiple ways to reach out, so please do continue to stay in touch with us as we move forward. Thank you.
Okay, I'm gonna, is the microphone live? No, I think I turned it off.
This one is still on, but I don't know if it's actually connected to